So my background is I graduated from the University of São Paulo in Brazil, and where I got my DDS. And then I volunteered for 2 years to do research in the laboratory of the University of São Paulo, where I did periodontal research with fibroblasts. And at the same time, I did my perio-specialty, and that's when I really fell in love with research, and I decided to pursue my PhD. So I applied here, and I entered the U of M in 2006, and it was a great experience. You need a lot of persistence and hard work, but it's an amazing experience that you have during the PhD. Probably the most fun years, I would say, of my life. You really push to your limits and what you can achieve in life, I would say. It's great. And then so I graduated and I started my postdoc position as a postdoc research associate at the University of North Carolina at Chapel Hill. Because 75% of my time is dedicated to research. So basically I am right now, I do experiments as I did during my PhD, but I'm more involved in writing projects to try to apply for, I'm going to apply for an award next year to eventually get a more of a permanent faculty position. So it's preparing me to the next step. It's the time of your life where you are allowed to make mistakes. And I did so many mistakes, and I do not regret doing that, because that was the only way that I could correct myself and learn, and I could push myself to my limits and then evaluate, well, was that a good move or a bad move, and then just don't do it anymore or just keep going in that direction. For example, when I entered the program, I had fear of speaking in public. And after my first, I didn't want to speak because you don't have to in Brazil. You have the two groups, one that talks and one that does the work. I was the one that did the work, so I never had to present. And then my first journal club here, I cried at the end because I was so stressed. And now I can go to meetings and speak in public, and I feel good about it. So it's something that I managed to develop during the PhD program as well. So, like I said, I would say just push your limits and you will be surprised of what you can achieve.
Dr. Chun is a clinician scientist with expertise in research, periodontics, and teaching. After she attended dental school in Germany, she was engaged in clinical teaching before she started the specialty training in periodontics at the University of Michigan. She completed the Oral Health Sciences PhD program in 2009. Currently, Dr. Chun is an assistant professor in the Department of Periodontics at the University of Texas Health Science Center at San Antonio. Her laboratory focuses on research in tooth development. She is mentoring pre-dental, dental, graduate students, and periodontic residents on their research projects. She is also teaching periodontics to dental students in the pre-clinic, clinic, and lectures. When asked what key actions were taken towards her success, Dr. Chun replied, "I was fortunate that my PhD training prepared me well for my current position. The research environment and faculty were key for her to find her direction." Dr. Chun's career path and goal is to expand her research program. She would like to continue being part of teaching and mentoring students at different levels of their career. The advice Dr. Chun has for our current students and future students include: work hard and follow your interests persistently, be open-minded for any kind of opportunity, and find generous mentors and listen carefully to their advice.
Turki Al-Hazazi graduated from King Abdulaziz University Faculty of Dentistry with a bachelor degree in dental medicine and surgery in 1998. After finishing 1 year of internship, he joined King Fahad Armed Forces Hospital in Jeddah as a general practitioner, where he worked for 5 years. In 2004, he was appointed as junior faculty at KAUD and was awarded a full scholarship to pursue postgraduate studies in the United States, where he enrolled at the University of Michigan School of Dentistry. He graduated in 2012 with a PhD in oral health sciences and a certificate in endodontics, and he was also awarded Fellow of the Royal College of Dentists of Canada in endodontics. Turkey's current position is an assistant professor at King Abdulaziz University, where he's head of the oral biology division. His duties include supervising the performance of students from their second to fourth year. During that time, they're taught dental anatomy, oral histology, and oral biology. Turkey's other responsibilities include supervising undergraduate and internship students in research projects, and he teaches endodontics at both undergraduate and graduate levels. When asked what a typical work week is like, he said, "The nice thing about being in the academic field is that there isn't a typical work week. Each week can be different, and the responsibilities and challenges are always on a different basis and rhythm. Some weeks he has to give several lectures and courses. Others he can focus on his research work and help other students with their projects and career mapping." Additionally, the dental school lab at KAU FD was just relocated, and he is setting up his new research lab space, which has a new look and state-of-the-art equipment. Outside school working hours, he is also a partner at the Al Mashfa Dental Clinics, one of the most prestigious dental clinics in Saudi. He works there 3 times a week, where he performs several root canals per day and enjoys interacting with his patients. When asked what key actions were taken towards your success, Turkey replied, "Looking for the right atmosphere, including the school, and the right people that inspire you with positive attitudes are also key factors to a successful career. I consider failure as a step towards success. You might find it difficult to believe, but trust me, if you haven't occasionally failed in achieving things, you won't enjoy the feeling of success and real achievements." When asked, "What is your career trajectory and goals?" Turkey said, "I would love to see myself in the near future a successful and well-known educator, researcher, and clinician, not only locally but also internationally."
I was a graduate of the University of Michigan School of Dentistry, a clinical training first. I went through the dental graduate program here. In 1990 I graduated, and then I did a clinical advanced hospital dentistry training program at The Ohio State University. I knew going into dental school that I had no desire to go into private practice dentistry. I really enjoyed the academic environment. I enjoyed the stimulation, the encouragement, and the support from a variety of specialists. I also was fortunate enough to have some basic science research training as a dental student. However, at that time, I did not pursue advanced training. After a few years of clinical work back here at the university as a junior lecturer, I decided to go back and pursue advanced training in the basic science research. Honestly, I wanted to really substantiate my teaching in the clinic as well as in the classroom with evidence-based dentistry. I was concerned about teaching anecdotal dentistry, and I really wanted to make sure I did my very best to support my teaching with scientific evidence. So I did the Oral Health Sciences program here at the University of Michigan, and it was a very rewarding experience. I was able to collaborate, meet with some very interesting, very talented and skillful people in the field of basic science research in the oral health sciences. I direct or co-direct 3 courses currently, and in that capacity I'm able to work with basic science researchers. And as a basic science trained clinician, I'm able to make that connection between the concepts that are taught in the basic science classes and clinical patient care. So as an example, I facilitate case studies with specific patient care scenarios within the didactic courses. So in this way, hopefully I'm serving as a connection between basic science concepts and the clinical challenges that we encounter in patient care.
Proud to be involved and be part of the top administration of my institution at King Saud University, where we actually are involved in setting the missions and the visions and all the future development for the college. As such, we have worked on multiple phases of our strategic planning, and we're involved in all the quality and development aspects at the school. However, these administrative duties do, in a way, take a little bit the person from the actual academic life, which is one of the most enjoyable things as well, is to get involved with the teaching of the students, whether it's clinical teaching or didactic teaching. But as an academician, you actually interact with the students, and the most satisfying thing in the teaching process is when you see the students, their eyes start to sparkle when they get it, and it makes you feel, yes, this is worth it, and it's very rewarding then. The clinical part of my career, or being a clinician, is an extremely enjoyable part of my daily life that I don't wish to neglect, and I do enjoy very much the rapport I have between myself and my patients, and it makes me, I feel, a better academician, a better researcher, a better teacher. I develop my skills further. I have never thought of actually stopping my clinical practice, at least at this stage of my career. It is very rewarding from an academic point of view. It enriches one's portfolio of cases which you can use also. The students, I believe, get to benefit from some of the cases, especially the difficult ones that I treat in my private practice.
Hi, my name is Erica de Boever and I was one of the first graduates of the PhD program back in 2000. I now live and work in Philadelphia, where I do clinical development for GlaxoSmithKline. I want to take a few minutes to talk about my career path and what it's like working for a pharmaceutical company. So I've been with GSK for over a decade now, and I initially worked as a clinical scientist on a malaria medicine, writing study protocols and study reports and helping to set up and execute phase 3 clinical trials. Over the years, my responsibilities have increased and I've changed roles and departments a few times. And actually, I think that's one of the advantages of working for a large pharmaceutical company. It's an environment where you can have the opportunity to have a career change if that's what you're looking for, or try new things and take on new challenges. And because we're a global company, a lot of our work is also conducted on the phone. And so that's probably why a few years ago, when my youngest son was about 4 years old, and his teacher asked him what I do for a living, he said, well, my mom, she talks on the phone all day and she tells people what to do. So aside from being able to tell people what to do, I sometimes get asked what it is I like about working in industry. And I think for me, it boils down to 4 or 5 things. I love science and I'm passionate about doing something that may ultimately help improve people's lives. And I really think this job allows me to do those 2 things. I love working with people. Like I said, most of my job involves teamwork, either as a team leader or as a team member. So that's very well suited to my work style. Thirdly, GSK, I think as a big company, provides an environment to try new things, take on new challenges. So in summary, I think if you are someone who's hardworking, who's intellectually curious, who likes working with other people, and who's passionate about doing applied science that may ultimately result in something that will improve patients' lives, I think you should consider a career in industry, because it may be very well suited to you. But whatever you do, I think, I really hope that your career path is going to be as fun and rewarding as my job and work life has been. Go Blue!